Welcome back to the Human Perspective. Today we're in California and I'm joined by my friend June Kailes. I've known June since the 1960s. She has a very broad background and quite frankly, she's probably the most difficult person that I'm going to be interviewing. She's an explorer and she has paved many paths in order to integrate disability into the broad world. June has had her disability since birth when there were no laws protecting the rights of disabled people. She's been a part of the disability rights movement. Her breadth and depth of experience in disability and accessibility and functional needs, issues as a writer, trainer, researcher, policy analyst, subject matter expert, and advocate is widely known and respected. I think the best thing to say about June is she prefers not to color in the lines, but in the end produces a vibrant new image, which was not produced in the past. She has a unique ability to blend and bridge multiple worlds. She also has traveled pretty widely internationally, but that we're not going to really get into today. So welcome, June. Tell us a little bit about who you are.
Well, I'm certainly not a difficult person that you alluded to. Actually, a fairly easygoing person, but I am a disability rights advocate. I'm a writer, and I am a policy person, and I'm a person of many interests and many hobbies, and that can be a problem when you have that many interests in what you choose to focus on, because I can go off in many directions, but I do try and stick career-wise to healthcare and emergency management.
We've been talking before about your core values, and I think your core values really have impacted the breadth of work that you've done. So maybe you could share with us a little bit about what you see as some of your core values.
Well, in reflecting in the work I do and thinking about the values, I think probably independent living has impacted me the most in terms of my values. It's always taken a civil rights perspective and always honoring people's ability to take risk, to make choices, to really determine what they want and who they are, and to really be their own advocates and not accept other people's reality when they think it can be different and better for themselves. So I'm always trying to push the envelope and help people to feel their own power and then go after their own rights and defend their rights and really feel good about that. And
can you give us some examples of things that you've done to really encourage people to become advocates for themselves and express their views?
Well, I think in healthcare, Judy, I've always been interested in health, and I've seen the most ardent, fierceful advocates become kind of cowering wimps in the healthcare setting. Mm-hmm. And it's always kind of amazed me that these strident people just kind of have the worst time being able to defend their rights and their needs and voice their needs and be more of a partner rather than someone who's just accepting what they're being told. So I spent a lot of time working in training folks with disabilities to really be very forceful and clear about their rights and what they're entitled to and what they can ask for and what's not acceptable to them is something that they need to be clear about and not accept what somebody else thinks is best for them. So that carries over in a lot of the work I do.
So how do you help people learn these lessons?
Well, I think you do it in a number of ways. You're a coach, you're a mentor, you're a trainer, but you're also affecting policy so that the policy is there to better accommodate people to begin with. So it's not such a hard, heavy lift to get what you need in order to thrive or to get equally effective health care or to be treated the same as everyone else in an emergency shelter during a disaster.
So, you've worked in healthcare. You've been doing work in disaster relief. You've been doing healthcare policy work. You're involved with a national advisory committee for a major healthcare provider. How do you see the work that you've been doing influencing various aspects of the healthcare delivery system?
Well, I like to think of myself as a raging incrementalist because I'm forced to see things change kind of slowly. Part of who I am is impatient. So it's very hard for me to accept the pace of change sometimes in healthcare and in everything else I do. So it's, it's working on many, many levels. It's training people in healthcare to acknowledge and understand who people are and to honor what people tell, what people with disabilities say about their own lived experience and what they know is best for them in terms of what works and what doesn't work. And that's very hard for people to understand. And in all the fields that I work in, disability is very stereotyped, even though we don't think of it that way sometimes. People come to disability unless they live with it or they're part of the communities. They come to it with very ingrained biases and stereotypes. And helping people to understand those stereotypes, where they come from, and the fact that they really don't go away, but if people know they exist, at least they can kind of contain them.
So now you're talking, I would suspect, in the healthcare area, providers and people who, the broad array of people who impact an individual with or without a disability during the healthcare process.
Right.
So you're involved in helping to train them, to help them listen more at the same time that you're working with disabled people to tell them to be assertive and clear about what it is that they need.
Right. And I also work with people to attend to the details of what it means to accommodate people. Mm-hmm. And the fact that, when it comes to physical access or communication access or equipment access, the devil's in the detail, and you can't just kind of approach it from the 30,000 foot level. Grab bar has to be in the right place.
Right.
You have to have a system to be able to effectively offer someone an interpreter so they can communicate effectively.
You've been spending a lot of time on the whole issue of disasters, and we've certainly in the last few months seen a number of major disasters. If you could summarize, what types of progress do you think have been made over the last 10 years in the inclusion of disability in disaster preparedness and relief?
Well, that's a little big question. I think we're moving the field of emergency management away from thinking about specialness and toward thinking about known functions and known needs that need to be accommodated. Such as accessibility in a shelter, such as emergency transportation so people can evacuate a flood area, such as giving some people early notice so they can get out of there more quickly and safely than others. There's a lot of things. I think we've developed a bit of a bench in terms of people who are leaders in emergency management from the disability community. And right now, in the midst of Irma and Harvey's response and recovery efforts, we're seeing the disability community and independent living centers and our federal partners and state partners really step up and work together cooperatively and collaboratively. And that's a new bar. And we have a lot more bars we need to reach and raise, but I've seen a level of cooperation that I have not seen before.
So thank you very much, June. Once again, we've reached our 10 minutes, and as I said earlier, interviewing June was going to be difficult because of the wealth of information that she has. I'd like to thank our audience for joining us today. Please don't forget to hit the like button and share this video. Leave me a comment down below and let me know what you thought of our discussion. I look forward to our next discussion. Have a good day.